So initially after knee replacement, when you're in the hospital, you're going to probably have therapy twice a day, or if you go to an outpatient center, you're going to have therapy twice a day for the first couple days. When you're discharged from either one of those situations, you're typically going to go back to twice a week PT, and then in between you're expected to do the exercises on your own. I typically have the patients do twice a week PT all the way out till about 6 weeks after surgery. At 6 weeks after surgery, there's usually 2 or 3 different roads that we take. So one is patients are doing very well, they've got great motion, great strength, and they return to their own exercise program while still incorporating some of the PT they've learned in the last 6 weeks. There's another group that's doing pretty well but is either nervous or struggling with 1 or 2 things, and they typically get at least a few more physical therapy visits that they can use on their own. So they might decrease the visits to once a week or once every other week for 6 or 7 more visits, and then they're transition back to their own exercise program. And then there's a group that struggles, whether they struggle because of something medically, because we didn't control their pain, and they may need to continue with the relatively aggressive physical therapy regimen of twice a week for another month, or even go up to 3 times a week for another month to try to get them the motion and the strength that they need to have a successful knee for the long term.